My name is Olivia Mustard, and I'm a physical therapist here at Adena Fayette Medical Center. I primarily treat orthopedic patients as well as some neurological disorders, but recently I've gotten certified in pelvic floor physical therapy. I was inspired to get certified in pelvic floor physical therapy because I see it as something that is just not done enough. I see especially a lot of women who have been taught this narrative of when you have a baby, you are going to be stuck with a lifelong list of problems, whether that's bowel, bladder, or just pelvic pain. There's so many things we can do about it. And so seeing that kind of thing really inspired me to kind of take that jump and make sure that I can serve people in that way. A lot of times if somebody's having a lot of pain, first we focus on a lot of relaxation training, getting people to breathe, getting their muscles to relax, focusing on the whole person, not just those muscles specifically, or else we're not going to make much of a change. From there, we treat it like any other muscle in the body, whether that's doing some trigger point releases, getting to those muscles, helping them relax, just as we would any other muscle, doing some stretches, general mobility of the rest of the body that might affect that area. Prior to us having that service here, within the last 2 years, people would easily have to drive at least 30 minutes to get that type of care. And that can be something that can be enough for someone to just not seek it out. Primarily, my life outside of work revolves around my son. I have a son that's just over a year old, and so I'm kind of in the new phase of motherhood, about to have 2 here in a couple months. He's very mobile now, so I am just chasing around a little boy all the time and having a lot of fun. The Adena family in general has been kind of a legacy for me. My grandmother worked for Adena. My mother has worked for Adena for over 40 years. And through that, I have seen people, her co-workers and everything, stay within this community, not just getting their job here, staying a couple years and leaving, but staying lifelong throughout their careers. And I think that says a lot about just the Adena culture and the support that it gives to their employees. When I have a patient that comes to me that might be struggling, they're in distress, they've had pain for a long period of time, when I see them move forward and achieve those goals and eventually get to discharge from therapy, I feel a lot of pride and I feel a lot of fulfillment.